So my client was Miss Z. She was 24 years old. She's an administrative assistant at a trucking company. She has a 4-year-old son and is recently divorced. She no longer sees her ex-husband, does not speak with her family. She was abused at a young age, and when the abuse was spoken about, she was told that she was imagining things. She has come to counseling to talk about her depression as it has gotten worse in the last month since being passed over for a promotion. She's also concerned about her impatience with her son and the stress she is under with the lack of stable childcare and her employment. So the three questions that I chose is the tentative hypothesis about your client's circumstance, an overview of how the generalist intervention model was applied with the client, and as well as one human behavior theory to inform understanding of the client. So the first one I'm going to go over is the tentative hypothesis. So my hypothesis is that she did not experience a stable home while growing up, and her caregivers most likely struggled with their own issues, which resulted in their not believing their daughter that she was abused by her uncle at a young age. Since she experiences no emotion in regards to the significant event that she had in her life from her family, she's saying that it's best to forget the experience, that she will not be believed when she tells others. So it's a learned behavior. This resulted in her needing to feel loved and cared for by anyone, which is why she married a man that she states that she did not love. She stated she felt she needed to be married and felt that she needed a husband. She was looking for connection, as all humans need, and then had her son. Her son is the replacement for the love that she needs to feel from her family and her husband, which is why she no longer pines for these relationships and doesn't feel the need to go on to the next relationship. She's also feeling inadequate at work, as she was recently passed over for a promotion on her job to another man who she feels is less qualified and has not been at the company for the same amount of time. So this has brought up her feelings of inadequacy with her family, as well as exacerbated her depression, as all of the men in her life seem to let her down and make her feel inferior. So the next question was the overview of how I applied the generalist intervention model. So in using that model, I did the following. So I greeted the client. And making them feel more heard and comfortable. I asked the name, preferred pronoun. I tried to gauge comfortability of the client by asking if there's anything I can do, such as getting a drink or adjusting any room temperature. And I also made sure to include some small talk to kind of lighten the mood and try to create rapport with the client. I assessed the situation with the client and listened intently. I listed her strengths for her and showed empathy by using empathetic statements. I asked relevant follow up questions in order to learn more and gauged safety from her perspective. So I listed the problems that were told to me, and the client and I came up with priority problems for us to work on together. We established goals for managing her depression, as well as specific objectives that should be met. For implementation, we plan to meet the following week to discuss implementation of the goals, like how she was able to reach them, and how I would be able to be more of support to the client if she ran into any barriers, as well as if we needed to revise the plan. So one human behavior theory to inform the understanding of the client, I chose attachment theory. So that theory focuses on bonds and relationships between child and a caregiver, as well as between romantic partners. I believe my client did not receive the necessary attachment relationships required from her parents, which resulted in her need for finding a romantic partner with whom she did not love to fill the gap, and ultimately resulted in her filling the gap with her son.